Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I wanted to talk to you about something that you have to do a good bit of, and I hope you understand why you do it. Bringing the upper teeth forward. You need to bring them forward in several situations. One of them, of course, is a class 3, just a small class 3 problem. Then you have to bring you have to bring the upper teeth forward to actually meet the lower teeth that are out here to help give some more room for the tongue in there. So frequently you have to advance the maxillary teeth. Then in cases where you have difficulty with the temporomandibular joint and you have to move their jaw forward to actually give them some relief where the condyle is pressing into this retrodiscal tissue. You have to advance their mandible to do that. Now, if you advance the mandible and the teeth fit together good, then you've got another problem here. Like if your upper teeth, and this is not too good an example of that, but say the teeth fit real good together, the lower molar would be out in front of the upper molar. And if you advance the lower molar to where the cusp is coming up something like this, then you've got to advance the upper so you can get the cusp to come down in the groove on the case when you're through. In other words, it needs to fit, the teeth need to interlock in there, and if you advance them or advance the lower one, you'd have to bring the upper one forward to actually sock in together. Now this is the bigger problem in you can take somebody with a TMJ problem and put a split in their mouth, and a lot of times that solves all the problem. But then you've got the lower jaw forward in a splint, and then you put something in between the teeth back here as you bring it forward because there's no contact here, and so the contact is on the front teeth and in the joint back here, and that gives you problems. So in a splint, you put material in between here and a ramp that makes them bring the teeth forward. And if it works and everything goes good, you wear it for a good while to see that the inflammation and everything is gone and all that. And then you can come back and advance the maxillary teeth forward to where they fit again against the lower teeth. Now, that's easier said than done. I had a woman chiropractor one time. They sent me. It had an absolutely perfect set of teeth, but her joint hurt, and they fit together perfectly. And you had to bring her jaw out here to give her some relief. So now she's kind of class 3-ish, and the guy that I work with that put the split in sent her over to me, and I said, okay, fix the teeth where they actually fit. So I had to advance the maxillary teeth forward so that they would again fit on the lower teeth in this new position that the jaw had to be in to stop the TMJ problem. That gets kind of confusing there, but it's a thing that happens frequently. We have to advance these upper teeth because we had to advance the lower teeth to TMJ problems. And in class 3 cases, the lower teeth are already out there, so we bring the upper teeth forward to try to match them with the lower teeth and bring the lower teeth back some too. We do that. We talked about that in extracting the lower 6-year molars to bring that back. So there's several ways to do that, and I want to try to touch on some of them this evening. Now, in this particular case, we used a headgear that doesn't push back on the mandible at all. A lot of the headgears are forward positioning jaw headgears. I've got some cases of them where they just wear a chin cup and the two little legs come up here and something coming over the top of the head, and you put rubber elastics on to bring the upper jaw forward, but it pushes back on the mandible. Now, if you push back on the mandible too hard, you shove the condyle back into the retrodiscal tissue, and in many cases, the person just can't tolerate it. Sometimes I've used class 3 elastics, you see, to bring the jaw back. And if you're using class 3 elastics, you just automatically are shoving the jaw back and shoving the condyle into the retrodiscal tissue. Now, some people, the condyle's far enough forward, you can do that and get away with it. Or else some people are just absolutely tough and it doesn't bother them. But most of the time it does give trouble. So there's a lot of cases where you're going to need to bring the maxillary teeth forward. Now let's go on here and show. Now this case was crowded and messed up, and we have to come in and do your regular orthodontics and all that good stuff. Just get them looking nice. But even you get them looking nice, they still have to bring the bottom teeth out some to match up with the upper teeth. So here this is what you can look at and see here, the upper teeth and the lower teeth, and there's just another view of it. Now this is a headgear. This lady worked for me, and she had a temporomandibular joint problem too, so we had to advance her lower jaw to get rid of the pain. And then when we had the jaw out here, we had to bring the upper teeth forward so that they would fit together again. It just makes sense on here. So there's frequent times that you need to use something to bring the maxillary teeth forward. Now this is a headgear that doesn't push. You got this band around the head up here, holds it real tight, and you've got these pads that come out over the bone right here under the eye, the cheeks, and then you hook the elastics to the maxillary teeth, and it kind of pivots off of this, and the head holds it and comes in the back end and back here. And this puts pressure on the cheeks up here, and the sinus is underneath there. And it doesn't work all that good, but the mechanics of it is good. In other words, you're pulling forward on the maxillary teeth. It kind of pivots off of this, and then your headgear band holds this down, and it's just strapped around the head like that, and it will move the teeth forward without putting any pressure on the mandibular teeth. Now, if you use a chin cup type headgear, you come off and come over the head, you've got a deal, comes a strap, comes over here, and you've got these legs coming up. Let me erase that. On a chin cup, you'll have a cup, something like this, and then you have a bar goes around, and the deal goes over the head. It comes in and does the same thing. On the other side, we've got cases with that hooked up. You can look and see. And then there's some legs that come up out here, and you hook your upper teeth to these legs, and it does pretty good. It pulls the legs out, the teeth forward, but it puts pressure on this chin cup. So the chin cup kind of pivots off of that, and it kind of pivots off the top of your head up here. But it also pushes this condyle back and where it fits in the fossa, and it can give you trouble on some people with weak joints. So even this one is the only one that doesn't put any pressure on the maxillary, on the mandibular teeth to move them back at all. Now let's go on to a little bit more. So this is a possibility. I guess if you really looked at everything possible, you could, if you had your teeth all banded up here and you had a bucket of rocks that went up to the ceiling and came over with a rope, and you could lay down at night and hook your upper teeth to that, and it would pick your head up. Now, I haven't tried that, but that would work if somebody did that. Now, the orthopedic surgeon had a deal where you hooked it on your head up here, and you hooked it to a rope that went up to 2 pulleys and dropped down, had a weight over here, and I had a little trouble with my neck, and he had me wearing this, and it picks my head up and took the pressure off my head, off the neck. And I had a weighted deal and the ropes and a deal that fit over that. Now, if you took this and you lay down and hook it, it would pull your upper teeth forward. There's a lot of different ways if people wanted to really do it, but we do very little. So you have to come up with several different ideas of how to get the upper teeth forward. This is just one of them, and the chin cup headgear type is another one, and they make a face bow deal that you just hook on and push back on the chin. So there's a lot of different ways. This looks good, but it was very uncomfortable for this lady. But if you wore it, it would bring the maxillary teeth in this direction. And then you had to bring the lower teeth out here to solve the joint problem. And so you have to put the teeth together again. And so you have to bring the upper teeth out. And so in doing TMJ work, a lot of times the getting rid of the pain or putting them in a splint is the easy thing to do. And the tough thing is to move the teeth forward so that the upper teeth forward so that they fit together in a comfortable way for the jaw to function. Okay, this looks complicated as all get out, but it isn't. This thing just comes up, has a strap that goes around the head, all the way around over here. And this bar comes up, and you can lock this down in a certain place to put the weight onto the cheeks right along here, and you pull forward on this, is pulling forward on the maxillary teeth, and it kind of pivots, it kind of operates back and forth like that, but the head strap holds it in place, and so the pressure is really on these cheekbones, and that seems to aggravate people quite a bit. So this is not an ideal thing, but it will work. And so I'm going to just put it in there. That's the way we got her maxillary teeth forward. And then it matched the jaw that we had to bring forward to get rid of the jaw joint problem. So here's just some other deals. We did the orthodontics, and we went in, straightened all the teeth out and all that good stuff. And now here this elastic is going back and hooks into the cuspid tooth right here, and you've got an archway that's tied back, so everything is pulled forward from this side simply by elastics, you see, coming out of this deal that's pivoting off of the jaw. I hope I can show you that, and where you could be able to do it if you needed to. Now this is just the other side with the mouth open and elastic going back into the molar or this is probably a crossbite. You remember her teeth were in a crossbite in here, so we're expanding these teeth. They're coming in this direction, and this one is going in this direction. The upper teeth were out too far over this way, so it's matching up the teeth with that. Now she's also had an elastic hooked up, I believe it's the cuspid going out this way. That's what it was. Now, these things get confusing, and to show somebody exactly what you do here. Now that's got the elastics, you see, upper. This is a crossbite. See, this tooth is a little far out to the buckle, so we're wearing elastic like that. Plus we have this, so we're correcting teeth, just doing regular orthodontics, and at the same time we're pulling this forward because we had to bring this forward to get our jaw joint problem over. And that happens in the vast majority of these TMJ cases. The condyle is shoving into the retrodiscal tissue. All right, here we are at 93. We've got things going pretty good. Now, there are other ways of doing a minor amount of advancement of the maxilla. Like you can take something and strip between all the teeth like this. You can go between these teeth. Over here with the stripping device, and the one back behind here too. Now in this case, you've stripped, you make a little space in there, and now you bring the back teeth forward like that, and there'll be little spaces in here that you'll close up, and you add all those together, and that would be how much you advance the maxilla. Now, you can go down on the lower arch. Let me erase that. And you go on the lower arch, and you do the same thing. You won't have the bands or anything. You just strip all the way around like this. Just go between the teeth. Now you got little spaces between here. And on the lower arch, you close the space by going back on the teeth. In other words, you wear class 3 elastics, which pull these teeth back and pull the upper teeth forward, and you close up those little spaces going in this direction, and you find out that your upper jaw then is a little further forward than the lower jaw. And so that, in frequent cases, that's what helps. That brings it out. It gives you about a millimeter of space that you move the upper jaw forward in a case like that. Now, there's another way where you tip the teeth. In other words, you can take the upper teeth and they may be going this way, and you tip them a little bit in a forward direction, and the roots are in the bone, and so the crowns move forward some. And on the bottom, once you tip them reverse, you bring them back like this, and the roots are in the bone, and it brings the crowns of the teeth back. This brings the crowns forward, and you make the crowns fit together like that. And I think this is 4 or 5 different ways of advancing the mandible. You have to do that to solve the TMJ problem. Then you've got to move the maxillary teeth forward to where they fit together like that. So orthodontics is not that simple when you get into these TMJ cases that you have to do things. Now here's the lady after we finish. It's 1994, and we put her teeth together and just really fix it up really nice. Now her lower jaw is a little further forward than it was when we started, and then I had to bring the upper teeth forward to bring that together. In other words, we moved this jaw forward to get rid of the jaw pain back here, and then we had to advance the maxillary teeth to where they fit together in these different places like that. Now, I hope you get something from this. If you get to do a lot of temporomandibular joint work, you would have to learn this. And then if you do class 3 cases, just mild class 3s, you can do them the same way, like that. Now, I didn't mention another way. Let me back up here and show you that on this lady's teeth. Now, you can go in and put tads. You put a tad on each side in here and put a spring that works between here and goes back, and you have a little silly hook on it or something like, and you bring that back and hook it here, and it's pushing forward on the teeth. And it's still, you bring it back and hook it, and it's pushing out on the teeth. So you can advance the maxilla by putting tads in the palate like that. Now it pushes back on the palate, but then that doesn't move much, and the teeth will move out, and you'll get enough to fit where you do the TMJ work, and you bring the mandible forward, and you got to bring the maxillary teeth forward. So that's another way. This is going to drag on and on here. Let me see. All right, so we're going to close up, and I hope you can produce stuff that looks like that, and you can do the regular orthodontics and do that, but you got to have the upper teeth forward if you bring the lower teeth forward to solve your TMJ problem. I hope you look into this, and if you're involved in orthodontics, and everybody, even individuals that aren't dentists, ought to understand some stuff about the jaw joint. And if they look at this and they have this problem, and you live in an area where nobody does it or can help you, take the video to him and show it to him. There may be several videos that have things that are involved in that. So thanks again for watching, and I'm going to try to close out here and see you later. Bye-bye.